Hi, my name's James Wooldridge and I'm the lead for Recovery Devon, and I'm also the Time to Change Regional Coordinator for the South West. I've been using Devon's mental health services for approximately 28 years now, so quite a long time. And over the years I've received, I would say, a good level of service in the most part. And when I heard about listening into action and was asked to take part, yes, I was a little sceptical at first. I perhaps felt that money could be spent on other things, maybe more nurses or maybe extra beds, as we seem to have lost quite a few over the years that I've been a patient, for sure. So I was a little sceptical at first, and I think some of the staff would recognise that feeling as well. However, thinking about it further, better engaged staff means better care and more time to be spent with patients. And I'm sure this applies to most of the staff throughout the Trust. They really want to be able to do their job without being hampered by too much paperwork and bureaucracy. Although it's an important part of the role, I still feel that the essential part of providing mental health care is around conversations and around helping people through their difficulties. So that's what's important to me. I think if staff feel more able to do their jobs and are happier in those jobs, then that results in a better care for their patients. So thinking of listening into action and how it works, I guess it sort of does what it says on the tin. It's about listening to staff, and some staff have some very innovative ideas about how things can be improved or changed and made for the better. So we introduced a series of quick wins, and bear in mind that these aren't all ideas from the senior management that sits on the listening into action panel. These have come from staff themselves as to what we can do to make their work easier and more productive. So, for example, one thing I was able to suggest was around having staff talk to the board. Now, already patients and people who use the services are invited to speak to the board at board meetings and give a sort of candid expression of how they're finding their time within that service. And my suggestion was that perhaps staff should be given the same opportunity. And it reminded me of when I was in the army. We had a phrase that you could use when going to see your senior officer that was "permission to speak freely, sir." And I like the idea of people being able to say exactly what's on their mind, I guess within reason, but that way you get a really good feel of what's happening at the shop floor and at the coalface. And I think you can find out much more by giving someone the freedom to speak without sort of punishing them for being negative or whatever. I think people need to be able to express what's on their minds. Certain things that are important for me within the Trust that listening into action can help with are things like not taking its eye off the recovery agenda. I feel that recovery is important not only to every patient who's part of Devon Partnership Trust, but I believe that the staff wish to work in a recovery mindful way as well. And then we have other sort of maybe slightly newer ideas around peer support. This has been suggested for a long time now, and I really would push for another look into peer support, a fresh look, and looking at other organisations and trusts that are running very successful peer support schemes. I know there is papers being published within the Trust at the moment, but that's something for me that would really make a difference to many patients, and also free up again some staff time to do other things. One thing about freeing up staff time, I think if they can spend an hour less filling in forms, perhaps on Rio or whatever, that's great, but I would want that hour to be devoted to the patient care rather than being shifted to another area of bureaucracy. I also think that if a member of staff is spending 7 hours a day trying to find a bed for someone, that's an appalling waste of someone's experience and skills, and I really feel that even that person themselves must become very disillusioned with their role if they're having to spend that amount of time just finding someone a bed. So things that are important to me are about recovery, peer support, better engaged staff, meaning better care for patients. And I think my role with listening into action as someone who's extensively used Devon services is to try and keep the focus on the patient experience and actually what listening into action is going to do for every single patient within this trust. Thank you.